Hi, I'm Arlene DeCam. I'm a registered nurse with Harbor Hospice, and I want to talk to you a little bit about the use of morphine. First of all, why we use it in hospice care, and secondly, I want to show you how to draw it up. We use morphine for two reasons. One is for pain. Morphine covers a lot of different types of pain, and it works quickly. It can be given orally and swallowed, or it can be given inside the cheek or under the tongue, and then it can be absorbed. So even a patient who's not very alert, we can medicate with morphine. I also want you to know that we use it for shortness of breath, and perhaps that's why we use it more often at end of life. Shortness of breath is a symptom that most patients will experience as they come to the end of their life. And so morphine is not going to fix it. Oxygen won't fix it. But what morphine will do is help the body cope with a lower level of oxygen so that that patient can feel comfortable. When you give morphine, as we've ordered it for you to give, you're giving small doses and you're giving safe doses. If it's not effective, you call us and then we will adjust the dose accordingly. I want to show you how to draw up morphine. When you get your bottle from the pharmacy, there's going to be a seal on the top of the bottle. It's a little tricky to peel off. So take a sharp object, whatever you have available, a pen often works, wipe it with an alcohol swab, and then puncture the lid or that foil that's at the top. Once you've done that, you unwrap this handy dandy little lid. You put this into the bottle. You want it to be very secure. There's no gaps at all between the bottle and the plunger. What that does, that stays in there, and that gives us a leak-free seal. What you can do now is pull back on this syringe. There's no needle on this syringe. A lot of people worry about that. Pull back. I usually pull back past the first line. Again, we're always going to start with the smallest dose. And then I'm going to take my plunger and I'm going to line up the actual morphine, not the top of the plunger, but the morphine with that first line. That's a 5 milligram dose. When I've got it measured, turn it back over, take it out, and you can administer to the patient. If your dose is 10 milligrams, that's going to be the line. That's halfway. That's 1/2 of an ml. 15 milligrams is at the 0.75 ml, and 20 milligrams is all the way to the top of the plunger. Now you see how I have air in there? I'm just going to push it back in the bottle, pull back again, and there I've got my full 1 ml. Sometimes morphine can be a little bit scary, and the symptoms that patients experience can be a little bit scary too. So what I recommend you do is when you have a patient at home that you're caring for, maybe draw up your morphine and put it in a safe spot away from children, pets, other people, and you have it prepped and ready to go. That way, when that patient, your loved one, is short of breath or is having pain, you've already measured it carefully and you've assured it's a safe dose. You give it. And then, after you've given it, you can draw up your next dose and have it ready to go for the next time. And that is the best way for you to administer morphine to your loved one. You know you can call us at any time with questions. The number you would call is 231-728-3442.